Hello, ladies and gentlemen. Thank you for having this opportunity to share my presentation to you. First of all, my name is Sean Bosconi, who is a student at Nestle Engineering in year 3 in the Biomedical Laboratory Department. Within this presentation, I'll be talking about antigen-antibody interactions. Basically, in the diagnostic test, these different tests in the clinical laboratories are based on antigen-antibody interaction. They are used to detect the presence and the concentration of antibody and the concentration of antigen present in the patient's blood plasma. In this case, we be looking at precipitation reaction. We also be looking at radioimmunodiffusion assay as technique to be used. We also look at ELISA techniques, which is subdivided into indirect and sandwich ELISA technique. Yeah, that's what will be covered in this presentation. First, by dealing with precipitation reaction, first of all, precipitation reaction to mean insoluble. Precipitation means insoluble, formation of insoluble in aqueous. In this also reaction, there is soluble antigen, which is being formed or present, and antibodies formed, which are present in the patient's blood. Once they interact together, they are going to form insoluble complexes at the optimum antigen-antibody ratio, which is known as zone of equivalence. To avoid the prozone or prison effect, there should be an equal amount proportion of antigens and antibodies, so that will be formation of a lattice between the interaction between antibody and antigen, forming a lattice which is very strong to make a precipitate which will be able to be seen visible. For radioimmunodiffusion as a special type of precipitation reaction, there are two samples which are major important, which is an antibody which is prepared on a gel, but also we need an antigen sample. Mostly found it's a blood plasma or a patient's plasma. This blood plasma is poured on a gel containing this antibody. If the antibodies are present, though, there is this antigen will diffuse radially, forming a precipitate ring directly when they are interacting to the bodies. By forming a precipitation ring, by using a ruler, this ring will be measured its diameter, which will help us to make the antigen concentration, to determine the antigen concentration within the patient's plasma. As it is here shown, here we have a gene matrix incorporated by an antigen here, but later an antigen with different dissolution was really added on this gel matrix, enhancing the incubation, allowing them to interact, and the interaction of antibody and antigen will be shown by forming this precipitate reaction. The higher diameter of the precipitate complex will determine high amount of antigen and antigen present in the patient's plasma, which is really forming a complex with, but also can be presented on the graph where antigen concentration can be determined by having precipitate ring diameter measured by the ruler. Secondary will be ELISA technique. Also, ELISA technique is based on the antigen-antibody interaction, where An antigen is binded to an enzyme conjugated antibody, as well as also a chromogenic substrate binds specific to the enzyme conjugating the antibody, resulting to the formation of a product which is colored. This product which is colored, or this color, by color absorbance, is also used to determine the concentration of an antigen present within the patient's plasma. Therefore, using spectrophotometer machine, it is used to convert this qualitative, a production of color which is qualitative data, into quantitative data, which are the concentration of antigen present in the patient's plasma. This is the structure showing how it is reacted. Here we have, on the fourth, we have antigen which is binding to the antibody, the primary antibody. Sometimes it's not there. We're also having a secondary antibody which is conjugated with an enzyme to mean enzyme conjugated antibody, therefore resulting or binding to each substrate which is chromogenic, which is going to give the color to the solution. We also have from ELISA, as I said, indirect ELISA and direct ELISA. The indirect ELISA is there to determine the quantity and identify and determining the concentration of antibody present in the patient's plasma. To mean we are determining the antibody present. By determining the procedure, we need antigen coated well, specific to the antibody we are just detecting, antigen well. We also, after having this antigen coated well, we add a patient's plasma with the other specific antibody where they are going to bind, therefore resulting to addition of enzyme linked antibody, but also specific to the antigen present, therefore end up adding a substrate which will lead to the production of a colored product. This colored product formed will be proportional to the amount of specific antibody present in the patient's plasma. From indirect, we will be having also a sandwich ELISA. A sandwich ELISA is also a special type of ELISA technique that is used to identify and determine the concentration of antigen within the patient's plasma. In the procedures, we need a monoclonal antibody coated well. Of course, they should be specific to the antigen which we are going to be detecting. The patient's plasma is also added within monoclonal antibody coated well. Therefore, washing is necessary so that we will be removing unwanted or an excess molecules. Thereafter, after adding the plasma, we may also need to add a second monoclonal antibody, also specific to the antigen. Should be antibody, enzyme linked antibody, conjugated antibody, which is also followed by addition of substrate to convert the enzyme into colored product. This also colored product is also used to determine the concentration of an antigen present in the plasma region. Actually, these tests are based on all tests, both precision test and ELISA, as well as other tests, are there to identify the quantity and the presence of antigen antibody present in the body's plasma. Thank you guys for being with me in this presentation. See you later. Thank you.